After more than 500 days at a Nanaimo hospital, a woman described as hard to house was finally moved into a special care facility earlier this week. She is just one of more than a dozen patients on Vancouver Island who are housed in hospital for their own safety. Tonight, the woman's doctor says Nanaimo needs its own special housing for patients with complex care needs.
After nearly a year and a half in Nanaimo Regional General Hospital, a woman in her 50s, described as hard to house due to complex medical issues, has finally been moved to a care facility in Victoria, where she will get special support.
And I feel the treatment was inappropriate for her to be in hospital so long. I have a feeling that people in the system, in VIA and in the ministry, weren't aware that a patient like this existed in their acute hospital.
The move came a month after the woman's case went public. She is unable to care for herself and too young for senior care. So instead of long-term care at an average of $175 a day, she spent 512 days in hospital at a cost of $1,500 a day. Her total stay, $768,000.
This is almost $750,000 on this one patient. That's a waste of money, but it's also not serving her interests. We have people in acute care beds for 150 days, 200 days, 300 days. 500 days is certainly the highest number I've ever heard of. I mean, that is almost a year and a half going on 2 years. It's ridiculous.
13 of the 30 hard-to-house patients across BC are on Vancouver Island, ranging in age from early 30s to 80s. All face multiple challenges for residential care or supportive housing because of their age or behavioral issues, which might put them or others at risk. They're mostly mobile but cognitively impaired due to brain injury, dementia, substance abuse, or mental illness.
I doubt if you'll find in Victoria General Hospital or the Royal Jubilee Hospital patients who are in there for 500 days. We're away from the centre of decision making, and I feel in Nanaimo here we need our own facilities to cater to our own group of patients.
2 wings of Cowichan Lodge will reopen next spring with 51 complex mental health and psychiatric beds. Health officials say discharge planning is underway for all 13 hard-to-house patients, but if they're unable to move them to appropriate residential care, the patients will stay in hospital for their own safety.